One of the most important things is to understand that anxiety is driven by threat. So um, the limiting your exposure to the threat is really important. So the media reports they tend to, they're quite scary. The media reports, they focus on what's not going so well, the number of death rates, the problems with PPE, things like that. They very rarely report the recovery rates and what's going well. So exposure to this threat material all the time is building and feeding our anxieties. So it's really helpful if people can actually limit their access, their exposure to those reports. So I would definitely advise people to just look once a day at a reliable source of information as well. The other scary things that we're getting exposure to are the reports on social media. There's a lot of misinformation that's coming through social media. So just ignore it. Ignore anything that you think is not going to be a reliable source of information. So that's one thing that people can do straight away. They can reduce their exposure to that threat information that's around all of the time. Another thing that's really helpful is if people actually write down their worries, and then they can have a look at what the worries are, or if they share those worries with a friend or a family member or a work colleague or their line manager. If you write the worries down, you can then kind of determine which of those things are within your control. And if they are within your control, then perhaps there's something you can do about it. You can plan, you can problem solve how to deal with it. But often our worries are kind of what if worries. What if this happens? What if that happens? What if the lack of appropriate schooling for my child leads to them not passing their exams? And then what if they don't go to university? And what if they don't, bigger and bigger, that kind of catastrophizing type worry. But we can't do anything about those worries at this point in time. That's a what if, a hypothetical worry. So noticing that's something that is not in your control, but thinking about it just brings you great distress. So park it. You can't do anything about it. Park it. Try and turn it into a worry that you can do something about. So if you're worrying about catching COVID-19 and you're traveling to work on public transport, how can you minimize your risk of catching COVID-19 on that journey or during work, using the PPE appropriately? So writing those worries down, sharing them with a friend is really important. And then the last thing really is that when you are not at work, or when you are at work as well, have breaks. Talk about normal things if you can. And then at home, don't reduce your or limit your exposure and actually do things that you enjoy. So clean out those cupboards that you've always been meaning to do. Sort out your photographs that you've always been meaning to do. Talk to your friends and family via whatever means you can. Do some exercise. Those things are so important to just ground us back into who we are as people and our connections with one another.